Hey everyone, it is great to talk with y'all today. You get casual Sarah today if you're watching on YouTube because it is Saturday, and if you hear a baby in the background, that's because she's here. Today we're going to talk about nipple shields. What is the big deal? They are such a controversial topic in the lactation space. Some lactation professionals and mothers love them, some hate them. It's really like such a polarizing topic. So where do I stand? Well, I believe they have their place, but I also feel like they're overused a lot. So let's get into it. So why do people use a nipple shield in the first place? I think the most common reasons are this. Number one, baby quote unquote won't latch. Oftentimes this is like right after birth and mom is struggling to get the baby on the breast, and for whatever reason they just won't latch. And so they have a shield suggested to them as a way to have the nipple really just like poking out and a little bit more firm so the baby can latch right on. Or I see that not mom is blamed, but it is blamed on mom having flat or inverted nipples when really her nipples are fine. It's just because the baby is not able to get a deep latch because they're a fresh new baby and they're tight or still learning how to nurse. There's mouth or body tension for baby, there's a lip or tongue tie, or the positioning is just not great. Latch technique is not great, and that's why baby's not latching on deeply. It's not that there's anything wrong with mom's anatomy or maybe even baby's anatomy. It's just that we need to do some adjusting of baby's position and latch technique to get them on the breast deeply. I often just feel like a shield is like such a band-aid solution. Unfortunately, hospital lactation consultants have such a hard job. They have so many patients to see and not enough time really to like see them thoroughly. I know this because I am working towards becoming an IBCLC and I'm doing my mentorship hours. And one of my mentors is a lactation consultant in the hospital. And so I see how passionate she is and how wonderful she is, so knowledgeable and just wants to help these families, but has so many patients to see. She can only do so much in the time she's allowed to be in there because she has to like manage her own schedule to get to see as many people as possible during her shift. So if they just can't get to a place where baby's latching well, it's like, okay, well, let's try a shield. I actually don't see her use a shield much. She really tries many other things and is often very successful and not needing a shield. But in private practice, in the outpatient setting, I see a lot of moms in my own practice, and I have another mentor who has her own lactation practice. And so I work with her a lot, and I see moms come in from the hospital who were given a shield because, quote, baby wouldn't latch. So yeah, when we just give shields out to fix quote unquote baby not latching, just won't do it with no follow-up, that's the problem. The second reason I see it used is, of course, pain with nursing. So again, when we just give it out as like a band-aid to like fix the current problem without giving follow-up instructions, or really just not assessing even before we're giving the shield, that's not great. But it can be a really good tool to make extremely painful nursing tolerable while you're figuring things out with your lactation consultant. And it can also be used to just like give that nipple a bit of a break to let it heal if it's gotten cracked. Personally, that happened to me. I had to use a shield for like 24 hours in the early days with my second daughter because her latch was just not good and gave me such an issue on one side that the lactation consultant I saw at the time was like, I know you don't want to use a shield, but your poor nipple needs to heal. So it works for that for a short period of time. And then I also see it being used if baby has developed a bottle preference and we're trying to get baby back to breast. That can facilitate, because that feeling is kind of similar to a bottle. So yeah. So all that to say, that's why oftentimes nipple shields are used. They have their place, but without proper assessment and follow-up, it can be really challenging because moms are left with this tool, which it is a tool, but it's also an intervention. They're left with this thing that now they have to have at every feeding, make sure it's clean, and they have no like exit strategy. Some of them don't even quite know why they're having to use a shield, and then they're really upset and frustrated when baby won't latch without a shield. I've even heard moms feel like, my baby doesn't like my bare breasts, like I'm the problem. It's like a personal challenge, which I could get on a whole tangent because I dealt with breast refusal with my first daughter, so I so see those women when they have that feeling that it's personal, that there's something about me and my breast that my baby doesn't like, and the guilt that comes with that, which of course all of that is not true. Babies are very, very connected with their mothers and prefer their mothers unless we intervene and change things. The other question I get about nipple shields is like, well, why are they bad? Or why do some lactation professionals think that they're terrible? So there are risks with using a nipple shield. So like I've kind of alluded to already, number one, we risk baby preferring that, like now that's their norm and that's what they're gonna want. And so weaning from the shield is challenging. It's also a barrier between the breast and baby. And so that can make it harder, especially if the nipple shield is not fitting properly. It can make it harder for baby to remove milk from the breast. And so this can lead to things like baby not gaining weight properly, or just not getting enough milk, getting the milk that they need. And if that's persistent over and over, that can lead to low milk supply. So it can impede milk transfer, which affects baby and mom's milk supply. So those are the major concerns with the nipple shield, apart from it being annoying to keep up with. So yeah, I'm curious. I'd love to hear from y'all if you used a nipple shield and loved it, or used a nipple shield and hated it. Shoot me an email, sarah@madetomotherlactation.com. I'd love to hear your thoughts, your story, your experience. I know what I've seen in my clinical practice. I know what it was like to use a nipple shield personally. I could tell that my daughter was not getting as much milk. She was feeding every hour. Now my nipple did heal, which is great, but there's many other techniques for healing the nipple that perhaps I should have employed at the time, but this was before I knew what I know. So yeah, it's a privilege to know what I know, what I've been taught from others who have poured into me, and I just want to share all that with you all. So food for thought about nipple shields. If you have a provider, lactation professional who recommends you use one, just consider all your options. Make sure, have we really fully assessed latch? Have we fully assessed my baby for latching problems like tongue tie or tension? Are there other things we could be doing? Like, why is it being recommended? Is it being recommended for letting my nipple heal? Are there other things I could be doing for that instead of the shield? Is it being recommended because baby won't latch? And again, looking into that. And then, but remember, it is a tool. It has its place. It has its pros. Some babies and moms do great with the shield. Some babies even transfer better with the nipple shield. So just another, I feel like every single episode I say this, but one-on-one lactation evaluation and support is just, I can't overstate it. It's critical. There's only so much that all of us lactation people can do and say online. We just can't get to the individual assessment of a mother and baby like we can in the office or in your home. Thanks for joining me for my brain dump about nipple shields. I'd love to hear from you again. Feel free to email me, or if you're watching on YouTube, comment below. I'll see you on the next one.